Have you been looking at your hair or your husband's hair or your daughter's hair or your loved one's hair and you're noticing that they have a bald spot? I have done the same thing. I have found a bald spot in my own head, in my kids' hair as well, and thought, how in the world am I going to fix this? That's exactly what we're going to talk about today. How do you fix a bald spot? This is Dr. Dwella Moten Nelson, your healthy scalp specialist. So the first thing you need to do to fix a bald spot is to understand why the bald spot is there in the first place. There are so many different reasons that bald spots can show up on your scalp. Stress can cause you to have bald spots. Diseases like cancer and autoimmune diseases like lupus can cause you to have bald spots. Having a chemical treatment gone wrong, like having a chemical burn on your scalp, can cause bald spots. Potentially you can have pulling or tugging if you have a certain style where the tension can cause your hair to be pulled out. Some people don't know this, but at nighttime they rub their heads back and forth on a pillow, and that can also cause their hair to come out. So that's friction alopecia. It's different from tension alopecia. You also can have medications. Like, there are lots of medications. If you look at your medication and look at the side effects, there are blood pressure medications, cholesterol medications, lots of different medications, diabetic medications that are shown to cause hair loss. All those things that we just mentioned, all of those things, stress, also your hormonal differences. So as you get older, your hormone levels change. That can cause your hair also to come out or cause you to have bald spots. Now, I know you're trying to find something that's great for thinning hair and also something that you can use for bald spots and little areas that are not growing in as quickly as possible. Our Nutritive Scalp Elixir Growth Kit is perfect for that. Just click the link below to go to the website and get the Nutritive Scalp Elixir Growth Kit. Also, genetics can cause you to lose your hair. So that's a whole list of 8 or 10 things that could potentially cause you to lose your hair. So the most important thing is that you're noticing that you're losing your hair. That's the first thing. The second thing is, what do we do about it? One of the best things that you can do to try to grow your hair back in or keep the hair that you have to kind of differentiate. So it's important that if you're trying to grow your hair back, so for instance, if you think of someone who's had a bald spot for a very long time, say you've had a bald area on your scalp for 8 years, it's going to be much, much harder to grow that hair back than someone who is just starting to see thinning. So that's why I always say it's super important that if you're just starting to see thinning, that you do something right away. Don't wait on it. Don't say, oh, I'm going to do something 2 months from now or 2 years from now. Do something right away, because it's much harder to grow back hair that's gone completely dormant. So the first thing is you want to take a good analysis of your scalp. If you think you have a scalp condition like a disease or alopecia or lupus, or you see inflammation on the scalp, or you're feeling like your scalp is tender to the touch, my suggestion is always to see a dermatologist. See a dermatologist, let them look at your scalp, make sure there's no inflammation there or no issue with your actual skin on the scalp before you do any kind of treatment. So that would be my step number 1. Number 2, take a look at your own scalp. If the dermatologist says, hey, your scalp is healthy, you're just having some thinning because of age or because of genetics, if your scalp pretty much looks very healthy, I would really start to change what you're using on your hair. So if you're using a shampoo that might be sulfate heavy or have sodium lauryl sulfate or may have chemicals in it that are known to thin hair, I would say take that off of the table. The second thing that I thought of, it's funny because we don't really talk about this, but when men start to work out more and their testosterone levels are higher, because you have more testosterone in your body, you have more possibility of forming DHT, which basically blocks your hair growth. So you may see people that are working out a lot and they are starting to experience hair loss, or there's a lot of testosterone inducing vitamins that you can take that many men are also taking. If you're taking those vitamins and you're starting to see that you're losing your hair, it could be linked to those things as well. So just be mindful of that when you're taking vitamins or when you're working out or you're taking they have also injections and infusibles that increase your testosterone level, and all of a sudden you're starting to see your hair starting to drop or starting to see your hair fall out. It could be linked to those higher levels of testosterone. Because if you have higher levels of testosterone in your blood, then it's a high potential that DHT will be created from that testosterone, and it will block the efficiency of your scalp being able to accept nutrients from your blood, okay, from the bloodstream. So keep that in mind. So that's the second thing. You want to be mindful of those two things. The other thing is, I said the shampoos, making sure that you're not using something that has sulfate or sodium lauryl sulfate, because that tends to dry the hair out. If the hair is dry and brittle, it's going to break more. The next thing, you can potentially take hair, skin, and nail vitamins. They usually have biotin in them, and that will help to fortify and increase the nutrients to the scalp that your hair needs to be able to grow. Another thing I love, they have so many great keratin shampoos. I'm not a big advocate of protein treatments, because I think protein treatments sometimes can be overused and dry the hair out and cause the hair to be more brittle. But because 95% of the hair is made of keratin, doing a nice keratin conditioner can be really great. Of course, run that idea by your cosmetologist, because she is a specialist on taking care of your hair, making sure that your hair is nice and healthy. The other thing I'll mention, massage, doing scalp massage. Doing a very gentle massage. If you're already seeing some thinning on the scalp, you're already seeing that your hair is a little bit thinner than it used to be, don't go in and do a vigorous wash with your nails or dig into your scalp, because the hair that's on your scalp can easily become dislodged if it's at the end of that growth cycle. So you want to be really gentle. Use gentle products, but you also want to use gentle pressure. You don't want to use a scrubber or a scrub brush. You don't want to be vigorous. You want to be as gentle as possible, because one, you want to keep the hairs that you have, and two, you want to increase the blood flow at the scalp so that you can actually grow in more hair. The more hair you have, the longer that hair is, and the longer the hair stays there, the thicker your hair is going to look. And then for those areas that are really sparse, you want to potentially do a scalp detox. And what that does is that cleanses away all of the sebum and anything that's down in those pores. That helps those areas to be nice and clean, so that when your hair starts to grow again from that follicle, that it's able to push up and make a nice thick hair, as opposed to a little small baby hair that comes if there's not enough nutrients to really support their hair being grown through. So those are some steps that will help you to be able to correct a bald spot or to grow in a bald spot. We hope that these were helpful. Thank you so much for listening. This is Dr. Dwella Moten Nelson, your Healthy Scalp Specialist.